Parents across the country know firsthand how the pandemic has been affecting their children's mental health. Now, first, on CBS Mornings, a new poll from the Child Advocacy Group, On Our Sleeves, shows how those challenges are affecting parents in the workplace. The survey found that 53% have missed work at least once a month to deal with their children's mental health, and 54% have interrupted their workday at least once a month to address a child's mental health needs. Marty Bledsoe-Post is Executive Director of On Our Sleeves. Good morning. How are you doing?
Good morning. Thanks for having me.
So what did the survey reveal about the impact of children's mental health on parents?
Well, even when parents are at work, 30 to 50% of their mind share can be on worrying about whether their child's mental health is developing as it should and whether everything's okay. So, yes, parents are missing work and interrupting work, and even when they're at work, this is on their mind all the time.
So 41% of parents surveyed said that their focus and their concern on their children's mental health increased during the pandemic.
Yes.
Why is that so? And do you believe that once the COVID rates decline and restrictions lift, that these things will be resolved?
It's hard for us to predict the future, but our behavioral health experts are looking at the past 10-year trends and seeing that children's mental health issues are rising and parents are more and more concerned. So if we look back to look forward, we have to be ready for new adjustments as life after the pandemic continues to change. And we have to be ready to adjust with it and adjust for our kids and help them have conversations about their mental health with everything that's coming at them.
So what about parents that work from home? Like, how has that impacted their children's mental health and then also theirs?
Well, we asked parents, how disruptive has your child's mental health been and how disruptive has remote schooling been? And they were only 4 percentage points apart.
Wow.
So we know that it's been very difficult in both of those scenarios to stay focused and get work done when all this other concern is coming at them.
And I can assume that there's a correlation, but working from home and then also doing two things at once, being a teacher as well, that has to be difficult on parents, right?
Right. Parents are used to multitasking, but the last couple of years have been extra multitasking effort.
Now, what do parents have available for ways to help them deal with their children's mental health situation?
The first thing we can all do is start to break down the stigma around this topic. Half of all lifetime mental illness will present before the age of 14. So children have mental health needs just like adults. So if we can start to have this conversation with each other, with coaches, with counselors, with teachers, and in the workplace, then employers can join us in finding solutions and helping their employees be more focused and productive when they're on the job.
We've been talking about removing the stigma surrounding mental health for a long time. And like you said, it is difficult in the workplace. So what kind of advice do you give to parents that have to deal with that? Because sometimes you don't want to say anything.
Right.
To your friends, to your family members, and really to your coworkers.
Right. We asked parents about that, and coworkers and HR and colleagues, they came in at the bottom of the list of adults that parents want to talk to. But 85% of parents said they want to talk to another adult. They feel like that would be helpful.
Yeah.
And we know that workplaces can connect them to resources. So we suggest that you start small. Find one other parent in the workplace that you can trust. Ask HR some really general questions about what benefits you have available, what resources are there without mentioning a specific concern or diagnosis so that you can get a sense of what you can do. And then start to think about how do you build effort inside the workplace and be more transparent and say things like, I need to take a mental health day with my kid, or I need to be present with my child through something that's really, impacting him or her. And start to have these phrases come out so that we can all just break that stigma.
Communicating, that helps. Marty Bledsoe-Post, thank you so much. I appreciate you joining us.
Thanks.
If you feel like your child is in danger of hurting themselves, contact the National Suicide Prevention Lifeline at 800-273-8255. That's 800-273-8255.